So we're talking about the use of nitrous oxide for hair transplantation. And so first I'm going to talk about what nitrous oxide is. And nitrous oxide essentially is what it sounds. It's basically nitrous and oxide together. And usually it's a combination of nitrous and oxygen in this 50-50 mixture. The main effects of nitrous and what this works on is through non-competitive NMDA inhibition of the central nervous system. So essentially what this is going to do is going to act on your pain receptors, and it's going to provide pain relief. It's also going to provide some relief of anxiety. And this is all important to help with patients during a procedure, especially such as a hair transplantation, where there's just a short bit of pain with the local, and then really should be not much pain afterwards. The way we administer nitrous oxide is we want to make sure that your patients are only breathing nitrous at that point and not breathing room air, because that can dilute our nitrous concentration. And we typically use a face mask, or we'll have the patient breathe through a mouth adapter and pinch their nose. With things that we look for afterwards can be respiratory depression, although talking to many anesthesiologists and using nitrous now for over 4 years, we've never had that happen. You worry about decreasing your oxygen, but because we're using this in a 50-50 oxygen mixture, this should really not be an effect for our patients because we're providing them more oxygen than room air. Room air has approximately 20% oxygen. And the biggest thing that we're looking for is going to be nausea and vomiting for our patients afterwards. And surprisingly, our nauseousness and vomit rate after nitrous has been essentially zero. So patients are going to essentially feel, and I've done this with my first hair transplant procedure, is you're going to feel lightheaded, you're not going to feel much as far as discomfort or pain, and you're really not going to have much of a care in the world. It's essentially a euphoria. That's why nitrous is called laughing gas. One of the safest gases you can use, and it's actually used in pregnant women. So for our patients who want that extra degree of comfort with safety, you can use nitrous. And the cool thing about this is 5 to 10 minutes after administering nitrous, patients can actually safely drive. So awesome procedure, avoids opioids, avoids all the harmful things that can affect your neurocognitive effects, and you can actually get some work done later if you're using nitrous. So great material to look at.